So how much insulin do I need? This will depend on your own individual ratios. Let's practice using some examples. The total carbohydrate of your meal or snack is 30 grams. To work out your insulin dose, divide the total carbohydrate by your ratio. Example 1. If your ratio is 1 unit of insulin for every 10 grams carbohydrate and your meal contains 30 grams carbohydrate, then divide 30 by 10. 30 divided by 10 equals 3 units of insulin. Example 2. If your ratio is 1 unit of insulin for every 15 grams carbohydrate and your meal contains 30 grams carbohydrate, then divide 30 by 15. 30 divided by 15 equals 2 units of insulin. Carb-counted menus for primary schools. If you attend primary school and have school meals, carb-counted menus are available for most primary schools in the area. Please ask your dietitian for further information. Unfortunately, these are not available for secondary schools. If you are struggling to count carbohydrates at secondary school, please let your dietitian know so they can give you some help.
Session 4. Hyperglycemia is also known as above target or high glucose levels. You should aim for glucose levels between 4 and 7 millimoles per litre. A high glucose level is anything above 7 millimoles per litre, but immediate action needs to be taken if it reaches 14 millimoles per litre. The signs and symptoms of hyperglycemia, highs, can include feeling thirsty, needing the toilet more for a wee, lacking in energy and becoming more tired, over a period of time, losing weight and becoming thin. These are the 4 T's: thirsty, toilet, tired, thin. The main way to get your glucose levels back down is by giving more insulin. This is called a correction dose. It is also called insulin sensitivity factor, or ISF. This is the amount your glucose level drops when given 1 unit of insulin. An example of a correction dose would be 1 unit of insulin drops your glucose level by 3 millimoles per litre. Glucose target: the glucose sugar level that is preset by your diabetes team, to which your insulin dose is designed to reach in about 2 hours after an insulin bolus. A typical glucose level target would be 6 millimoles per litre. Active insulin time: the length of time the insulin remains active and available in your body. This feature helps to prevent overcorrecting of glucose levels. A typical active insulin time would be 3 hours. For example, it is safe to give a full correction dose if it has been more than 2 hours since your last meal or snack and your blood glucose is still above 8 millimoles per litre. If regular corrections are required, it means your insulin requirements have gone up and you will need more insulin on a regular basis. As you get older, especially during puberty, you are going to need more insulin, so insulin doses will need to be adjusted more frequently. If this is happening, you will need to contact the diabetes team so we can help you adjust your doses of insulin.
Ketones. Hyperglycemia can create ketones. This is discussed more in depth in the sick day rules section of this booklet. Hyperglycemia can also be caused by feeling sick or unwell, going through a growth spurt or puberty, stress, for example, exams. Having high blood glucose levels for a long period of time can lead to complications. See future complications section. It is very important that you gain good control of your glucose levels. The diabetes team will empower you to make your own adjustments to your insulin doses. Ketones are dangerous and must be checked when you have a high glucose level above 14 millimole per litre and you are feeling unwell, or if you are unwell with a glucose level in range and have no idea why. Any illness like coughs, colds, flu, and any type of infection can affect your glucose level and generally cause them to go higher rather than lower. The only exception is when you have diarrhea or vomiting. This would generally make you have lower glucose levels. Ketones are checked in the same way you test your glucose. You will use different strips for ketone testing and you may use a different meter. Your diabetes team will advise on this.
Management of hyperglycemia. Check blood glucose levels. Glucose over 14 millimoles equals hyperglycemia. When did you last eat? If less than 2 hours ago, encourage to drink water. Recheck glucose and ketones in 1 hour. Check ketones. If ketones above 0.6, follow sick day rules. Then recheck glucose and ketones in 2 hours. If ketones below 0.6, give correction dose as per your correction factor. This can be calculated on your insulin calculator. Encourage to drink water. Recheck glucose in 2 hours. If you ate more than 2 hours ago, is this an unexplained hyper? If yes, check ketones. If ketones are above 0.6, follow sick day rules. Then recheck glucose and ketones in 2 hours. If ketones are below 0.6, give correction dose as per your correction factor. This can be calculated on your insulin calculator. Encourage to drink water, then recheck glucose in 2 hours. If this is not an unexplained hyper, give correction dose as per your correction factor. This can be calculated on your insulin calculator. Encourage to drink water, then recheck glucose in 2 hours. Hypoglycemia. Hypoglycemia, or hypo, is another word for low glucose levels. You will have high glucose levels as well as lows. This is a normal part of diabetes. At the beginning, you might have lots of both as you learn to manage your diabetes. Hyperglycemia and hypoglycemia can be caused by a mismatch between food, carbohydrates, and insulin. Hypoglycemia, or hypo, is when your glucose level has dropped to below 4.0 millimole. If you feel different or look different, just check your glucose levels by doing a finger prick check or look at your CGM. It is really important you wash your hands first to get a correct result, as demonstrated in the practical skills session. Hypos are most often caused by too much insulin for the amount of carbohydrate eaten, extra exercise than usual, illness such as diarrhea and vomiting, stress or anxiety, hot or cold weather, hot baths. If your glucose level drops below 4.0 millimole, you will need to bring it back up as quickly as possible. A persistent low glucose can become dangerous. Make sure that you always have a glucose meter or scanner or mobile if you are wearing a CGM. Always carry hypo treatment with you at all times. Sometimes it is difficult to know why you have a low glucose level. Management of hypoglycemia. You need to treat a hypo if your glucose is less than 4.0 millimoles. If you think you are having a hypo, never leave it untreated, as you could become unconscious or have a seizure. This is fortunately very rare. Treat the hypo where you are. Walking around will cause your glucose levels to drop further, and this may lead to you falling or tripping. This is why it is important that you are always ready to treat a hypo wherever you go. Signs and symptoms of a hypo may include feeling hungry, sweating, looking pale, feeling grumpy and irritable, being wobbly or shaky, feeling tearful, having a headache or tummy ache, not feeling or behaving quite right, feeling tired or sleepy, unable to concentrate. How to treat a hypo. Wash and dry your hands if using a finger pricker, or use sensor if wearing one. Then recheck glucose in 15 minutes. Step 2. Treat again if still below 4 millimoles. Have fast-acting carbohydrates. Repeat these steps until glucose is above 3.9 millimoles. If you're concerned, please contact your diabetes team. Note, if hypo occurs before a meal, always treat the hypo first with a hypo treatment as previously discussed, and retest 15 minutes later. When glucose reaches 4 millimoles or above, and a meal is not due straight away, Have 10 to 15 grams of slow-releasing carbohydrates with no insulin to prevent a further hypo. This will be different for insulin pumps. Your diabetes team will advise you. Advice for parents and carers. Do not use chocolate to treat a hypo. This is because it is high in fat and releases glucose more slowly. If your child is unconscious, having a seizure, unable to swallow, or if there is a risk of choking, the best and easiest treatment to use is the glucagon injection kit. The diabetes team often refers to this as the emergency orange injection. You may have been given Ogluo to use. Please ask your diabetes team how to use this.
Advice for parents and carers, glucagon injections. Treatment of severe hypoglycemia. Glucagon is a hormone that raises the glucose levels by making the liver release its store of glucose into the bloodstream. Glucagon is given if the person is too drowsy, uncooperative, unconscious, or fitting. Do not attempt to give anything by mouth in any of these situations because this may cause choking. Place the child on their left side in the recovery position to keep their airways clear. Glucagon can be stored at room temperature for 18 months or in the fridge until it expires. Once glucagon is removed from the fridge and it goes to room temperature, do not put it back in the fridge. In an emergency situation, if you do not feel confident or cannot give the injection, then call 999 immediately. Instructions for administering glucagon. Remove the orange plastic cap from the bottle of white powder and the needle guard from the syringe containing sterile water. Inject all the water into the bottle containing glucagon. There is no need for shaking as the glucagon will dissolve into the fluid. Without withdrawing the needle, turn the bottle upside down. Draw up the solution into the syringe. If the child is under 8 years, measure 0.5 milligrams, which is half the syringe. If the child is over 8 years, measure 1 milligram, which is a whole syringe. Now inject all the glucagon with the same technique as you would insulin injection. However, inject deeper, also known as intramuscularly. Glucagon may take 5 to 15 minutes to work, therefore do not expect an immediate improvement. You must notify your diabetes team. If there is no improvement or you need emergency assistance, call 999 immediately. Recovery from severe hypoglycemia. When your child or young person wakes up after the glucagon injection has been given, they may vomit. The effects of glucagon only last a few hours, so they may risk having another hypo. To prevent this from happening, when they have stopped vomiting, it is a good idea to give a hypo treatment such as a fast-acting carb followed by a longer-acting carb to prevent a hypo from reoccurring. Glucose levels are often elevated following a severe hypo. Any high glucose levels after a severe hypo requiring glucagon should not be treated with extra insulin. You can watch the video on how to give a glucagon injection by going to the quick link section of the Deapp app. By familiarising yourself with the glucagon injection, you might find this less worrying should you have to use it. Some children or young people may not have any hypo symptoms, also known as hypo unawareness. If you think your child or young person may be experiencing a hypo, it is important to check their glucose levels so you may start to recognise their signs and symptoms and act quickly. You may be given Ogluo to use. Please ask your diabetes team how to use this.
Management of hypoglycemia. A glucose level below 4 millimoles per litre equals hypoglycemia. Take hypo treatment, fast-acting carbs such as glucose tablets. Wait 15 minutes and recheck glucose. If your glucose is 3.9 or less, repeat hypo treatment. Recheck glucose in 15 minutes. If your glucose is 4 or more and it's mealtime, have a meal and insulin as normal. If it's not mealtime, have 10 to 15 grams of slow-release carbohydrate. Once everything is fine, you can return to normal activity. Advice for parents and carers. Call 999 and ask for an ambulance if your child or young person is not responding to treatment, if they are unable to swallow, if they become confused or unresponsive. Place your child or young person in the recovery position. Do not put anything in their mouth. Give a glucagon injection or a Ogluo and wait for the ambulance to arrive.
Session 5. Sick Day Rules.
In this section, we are going to look at sick day rules, which means looking after your diabetes during illness. Having diabetes doesn't make you more likely to become unwell. You are not going to get more colds, coughs, tummy bugs. However, it can make your diabetes more challenging to manage. We will recommend that you have the flu vaccination at the beginning of winter every year. If you get ill, things like coughs, colds, flu, or any type of infection can affect your glucose levels and generally cause these to go higher rather than lower. The most common exception to this is if you have vomiting and diarrhea, which can cause your glucose level to go down rather than up, as you are not absorbing the food in your tummy. If you have glucose above 14 millimole per liter and you feel unwell, you should also check your ketone level. When you are unwell, your insulin does not work as well, and so your glucose levels go high. If these don't come down, you start to make ketones instead. Ketones are a byproduct of your body burning fat. This could lead to a very serious condition known as diabetic ketoacidosis, also known as DKA, where the ketones cause a chemical imbalance in the body. Because of this, it is important to keep a close eye on your glucose levels during illness. Understanding ketone results and what you should do. You will need to check your glucose levels and ketones every 2 hours, until your glucose and ketone levels are back within normal range. Ketones can be checked in the same way as your glucose levels, by pricking your finger and placing a spot of blood on a strip. You will be given a ketone meter that uses ketone strips to test ketone levels. Always make sure that you carry your ketone meter and some ketone strips with you at all times.
To understand ketone results and what you should do if your glucose is 40 millimole per litre or higher, here is some useful information. If you have negative ketones, which is less than 0.6 millimole per litre, take a correction dose to correct high glucose. This is in addition to a normal bolus for carbohydrates eaten, as per the insulin calculator or pump. Recheck your glucose and ketones in 2 hours. If you have small to moderate ketones, which is 0.6 to 1.5, give 10% of your total daily dose of insulin as additional fast-acting insulin. Then monitor fluid intake and ensure you are drinking enough fluids to keep well hydrated. Recheck your glucose and ketones in 2 hours. Repeat this until ketones are below 0.6. If ketones remain above 0.6, call your diabetes team or out-of-hours switchboard for advice. If you have moderate to large ketones, which is more than 1.5, give 20% of your total daily dose of insulin as additional fast-acting insulin. Then monitor your fluid intake and ensure you are drinking enough fluids to keep well hydrated. Recheck your glucose and ketones in 2 hours. Repeat this until ketones are below 0.6. If ketones remain above 0.6, call your diabetes team or out-of-hours switchboard for advice. Understanding the ketones levels. Green means that you have a ketone level of less than 0.6 millimole per litre. That's fine, anyone can have a small amount of ketones. This could be because you have not eaten for a while. Throughout the illness, try to eat if you can, but you must continue to have regular sips of water. This helps to keep you hydrated, which is important. If your glucose levels are high, give a correction dose of rapid-acting insulin every 2 hours. Amber means that you have a ketone level between 0.6 and 1.5. If this is the case, give 10% of your total daily dose of fast-acting insulin every 2 hours. Keep a close eye on your glucose levels. Carry on giving your long-acting insulin as usual. The final colour red means that your ketone levels are 1.5. This is a high ketone level which needs addressing urgently. Call your diabetes team for advice. You will likely need to double your dose of fast-acting insulin if you have a ketone cell in the red.
Understanding ketone results. If your glucose levels and ketones are still not coming down after 3 corrections and you're feeling more unwell or you start vomiting, you must call your diabetes team or out of hours for advice immediately. Throughout your illness, continue to drink water little and often. When you are feeling better and you feel like eating again, have food with your normal insulin dose. Just remember that when you are unwell, even though you're not eating, you may need higher doses of insulin to get you back on track. Remember, if you start vomiting, show any changes in breathing, or become drowsy, along with high glucose levels and ketones, you need to go to hospital immediately. It is important to continue with your long-acting insulin as normal. What you should do. Never stop taking your long-acting insulin. If you are unwell and haven't eaten for a while, you may find your glucose is below 14 millimoles per litre, but ketones are above 0.6 millimoles per litre. These are known as starvation ketones, and as long as you have a normal glucose reading, they are not dangerous. You are not at risk of DKA. You should contact your diabetes team or out-of-hours service if you are concerned. Take a look at the quick link section of the Deapp app for sick day rules information. Pumps. An insulin pump delivers tiny amounts of insulin into the blood throughout the day and night. You then add extra mealtime insulin using the pump. This can improve blood glucose levels by more closely matching your insulin needs. You attach the pump to your skin. Insulin flows into your body through a tiny tube under your skin. The tube is replaced every 2 to 3 days and is usually moved to another part of your body. A pump can give you more flexibility with what you eat and help you have more stable glucose levels.
Diabetic ketoacidosis, DKA. Insulin acts as a key unlocking cell doors to let glucose in for the body to use as energy. If there is no insulin, the cell doors stay locked, and the glucose cannot get into the cells to give the body energy. The body will try to get energy from somewhere else. It will do this by breaking down the fat in the body. When fat is broken down, it produces a waste product called ketones. If the body produces too many ketones, they can make the blood too acidic. Without insulin, and with the buildup of ketones, the glucose in your blood increases, causing the glucose to spill over into your wee. This will make you feel thirsty, as your body tries to replace the water lost. Eventually, you will become dry and dehydrated. The combined effects of dehydration and ketones building up in your body can make you very unwell. This is called diabetic ketoacidosis, or DKA, and it can be life-threatening. High glucose plus ketones plus feeling unwell equals danger. DKA is extremely dangerous and can be life-threatening if not treated immediately. If you have a ketone level of 1.5 millimoles per litre or above, you will require urgent medical advice. Warning signs and symptoms of DKA are feeling or being sick, rapid breathing, headaches, stomach aches, feeling more sleepy than usual, feeling more thirsty, going to the toilet for a wee more often, ketones in your blood, and a sweet smell on your breath. If you have these symptoms, you will most likely require hospital admission, so that we can increase your fluid levels whilst reducing your glucose levels. The safest and most effective way to do this is by giving insulin and fluids via a drip directly into your veins. You will not be able to eat or drink during this time, and you may be in hospital for a few days, so the diabetes team can monitor your progress. It is essential that you should never ignore a high glucose level above 15 millimoles per litre with high ketones. It is also important that you should never stop your insulin when unwell. The sick day section has more information on what to do at the different stages of ketone levels. By careful management, you will be able to prevent going into DKA. You can do this with regular glucose monitoring and insulin injections.
Session 7. Correction doses. When you are newly diagnosed with diabetes, your glucose levels may be higher than the target range your diabetes team has set for you. This is because your body needs to get used to the insulin, and it can take time to see how your body responds. Over the next few days, your diabetes team will look at your glucose readings and adjust your insulin doses. When your glucose level is too high, you will need more rapid-acting insulin to bring it back down to your target range. This may mean adding a correction dose to the dose of insulin given with your meal, or it may mean giving an extra injection of rapid-acting insulin in between meals. Your diabetes team will decide what action is required and tell you what to do. Before leaving hospital, you will be given your own individual correction plan. This will be reviewed each time you come to your clinic appointment, as it may need to be changed as you grow. A correction dose is usually given at meal times when you are routinely checking your glucose levels. If a correction dose is needed at meal times, you would add the correction dose to the dose you will be giving for your food. If you have to correct frequently, then this means your insulin doses need to be increased. Your diabetes team will advise you what to change. It is important to remember when giving a correction dose, there should be 2-hour gaps between doses. Your team will explain when to give correction doses. High glucose levels are a bit like a fire burning, and a correction dose helps to put out the fire. Think if your glucose levels are constantly high and you are doing lots of firefighting, your aim would be to try and prevent the fire from starting in the first place. It is important to contact your diabetes team if you feel this is happening, as your doses of insulin may need increasing. This is because fast-acting insulin peaks at 2 hours, but will continue to keep working up to 4 hours. If another correction dose is given before 2 hours, you run the risk of stacking your insulin doses, and this will cause a hypo. If you have high glucose levels and feel unwell, refer to Session 5 on sick day rules or contact your diabetes team for advice.
Session 8. Emotional well-being. A diagnosis of type 1 diabetes can be a huge shock for the whole family. Young people, their parents and siblings are suddenly tasked with taking on board new information and making practical changes to routines. Some young people will have been unwell for some time, creating added pressure and concern for the family. These experiences can be incredibly stressful, and it is normal for families to experience a range of emotions. In some cases, young people and families blame themselves, even though a diagnosis of type 1 diabetes is no one's fault. It can happen to anyone at any time. As a family, you may feel a sense of loss, sadness, anger, confusion, guilt, or denial. These feelings are common, and they are a normal response to adjusting to a big change. The process that follows diagnosis is a journey of adjustment as young people and their families get used to living with diabetes in their lives. Here are some useful resources. Diabetes UK School. Diabetes shouldn't stop your child enjoying school and having the same experiences as any other child. It's important that schools and parents work together to make sure that children with diabetes are getting the care they need and deserve. Go to diabetes.org.uk. Diabetes UK University. Starting university for most people is a massive change. For a lot of new students, it means moving away from home for the first time. If you have type 1 diabetes, use the information to help make sure your diabetes doesn't stop you getting the most out of your time at university. Again, go to diabetes.org.uk. Type 1 resources. A collection of resources for people with type 1 diabetes. The resources are reviewed by healthcare professionals and updated regularly. These can be found at t1resources.uk. Digibeat. Digibeat is a video platform and app, and is a one-stop shop for young people's diabetes management. Go to digibeat.co.uk. handbook.org. Health for Kids and Teens. Health advice and support through online web chat and school nurse texting service. They give information on feelings, growing up, health, lifestyles, relationships, sexual health, and local services. Go to healthforkids.co.uk or healthforteens.co.uk. Finally, Young Minds, a charity aiming to support children and adolescents' mental health. Offers free texting service for young people in crisis and a parent helpline. It also provides information and support around several psychological conditions commonly experienced by young people. Visit youngminds.org.uk.
More resources. Here are some useful books.
What to do when you worry too much.
Stepping Up magazine. Ask a member of the diabetes team for a copy. The Anxiety Survival Guide for Teens.
A Mile in My Shoes, a Type 1 Diabetes Guide to the Universe.
Get Out of Your Mind and Into Your Life for Teens. And Captain Lantis.
Self-care activities. Please ask a member of the diabetes team for an activity book. It has great ideas to help you, such as mindfulness activities or a mindfulness jar, well-being jars, distraction ideas, positive self-talk, self-care kit or self-care plans. An example below is balloon breathing. Balloon breathing. Think of your belly as a balloon. Place your hand on your belly and feel it rise and fall. Take a deep breath in through your nose to fill your balloon. Hold your breath for 2 seconds. Breathe out through your mouth to slowly deflate your balloon. Repeat balloon breathing 5 times.
Session 9. Nursery, School and College. Your diabetes nurse will arrange a meeting with your nursery, school or college, and they will be able to help them to understand what diabetes is. If you're not ready yet to give your own injections or do your own glucose test, your diabetes nurse will train staff on how to do this with you. There is a school pack from Diabetes UK explaining what your school's responsibilities are to help keep you healthy, safe and making sure you can continue with your education. Your diabetes nurse will give a copy of this to your school.
You will need an individual diabetes healthcare plan at school. This will help everyone understand what their responsibilities are and what is expected from them to keep you safe whilst at school, including any out-of-school activities. This should be done before you go back to school. Your care plan will be completed with your diabetes team, school, parents or carers, and you. According to the Equality Act 2010, you should be able to do the same activities as your friends and classmates at school. This includes any of the school activities and team sports. You should not be excluded from doing anything unless your diabetes team have advised you to do so. Your diabetes nurse will support you and your school in preparing a care plan for any activities you undertake, including any residential trips. It is a good idea to tell your friends about your diabetes. This will make life much easier for you at school, as your friends may spot the signs of high and low glucose levels before you feel it in yourself and can inform school staff. You may want to talk to them about how you are feeling. They will be able to help you if you are feeling poorly. They may even be able to join you for lunch when you are first in the queue. But best of all, if you tell your friends, they will understand more about type 1 diabetes.
Session 10. Exercise. Having an active lifestyle and doing exercise is important for keeping your body and mind healthy. Exercise can be a great way of helping to keep your glucose levels under control. it is important to find activities you enjoy. We are all different, and activity or exercise can affect us in different ways. How your body uses energy depends on the type of exercise that you do. It may be helpful to think of your body as a car. When you fill your car or body with petrol or carbohydrate, and then go on a drive at 30 miles per hour or a gentle walk, then your car uses fuel or glucose much more slowly, and therefore the petrol tank or body does not need topping up as frequently. However, if you drove your car fast, running, at 70 miles an hour on the motorway, your car would use fuel or glucose much faster, and you would need to top up the petrol tank or your body more often. Your glucose levels may be affected for some time after exercising. You may experience a delayed hypo several hours after exercise. This happens because your metabolism continues to use the glucose. This varies from person to person and from exercise to exercise. At other times, you may experience a high glucose level after exercise. If you are doing a very high intensity exercise or sport, such as sprinting, boxing, or weightlifting, then you might actually find your glucose levels start to rise. This is because when you exercise at a higher intensity, the body pulls glucose from its stores, including the liver, to make sure there is enough to fuel the exercise. Your body may also produce adrenaline when you exercise, and this temporarily reduces how well the insulin in your body works. For team sports such as football, netball, rugby, hockey, and tennis, you may have times in the game when you are exercising normally and other times when you are sprinting at maximum efforts. Therefore, depending on the amount of effort you are putting in and what sport or form of exercise you play, you may find your glucose goes higher, lower, or stays the same. You might find different changes in your glucose level with activity dependent on what time of day you exercise. This depends on how sensitive to insulin you are at that time of the day, how long it has been since your last insulin dose, and how long it has been since you last ate carbohydrate. If you play sport for a long time, you can sometimes see the effect on your glucose levels for some hours after finishing the activity, or even the next day. You might find on the day of a competition or tournament, your levels might be different, as excitement and adrenaline can affect your glucose levels. Unfortunately, we cannot predict exactly how much your glucose might change during activity, so regular monitoring of glucose is important. For PE in school, you might find that you are not active for long enough for your glucose levels to be affected. We don't recommend you change your insulin. Refer to the before PE exercise chart. Unless you see a pattern of this happening regularly, then your diabetes team can advise you on what to do. The prospect of managing your glucose levels during exercise can feel daunting, especially when you are newly diagnosed. Check your glucose regularly, every 30 minutes, during exercise or at any other time if you feel unwell. Exercise. If your glucose is below 4 millimoles per litre, this is a hypo. Do not exercise and treat with rapid-acting carbohydrates. If your glucose is between 4 and 7, take 10 to 15 grams of carbohydrate prior to exercising. A further 10 grams of fast-acting carbohydrate for every 30 minutes of exercise may be required. If your glucose is between 7.1 and 14, fast-acting carbohydrate for every 30 minutes of exercise may be required. If your glucose is 14 or above, you feel well and ketones are less than 0.6, it is safe to exercise. Drink plenty of fluids. If your glucose is 14 or above, you feel unwell and ketones are above 0.6, do not exercise. Drink plenty of water and ring a parent or carers. Treat with a corrective dose of insulin. Throughout exercise, it is encouraged to monitor glucose levels every 30 minutes, or if you develop symptoms. If you have gone too high or too low during exercise, then don't worry. Speak to your diabetes team and they can advise you on what to do next. Your team can recommend if you should reduce your insulin doses to avoid hypos. When you learn to carbohydrate count, you will be able to calculate the amount of carbohydrate you need for exercise to keep glucose levels stable. In time, you are going to become an expert in knowing your own body and how to change your insulin and food regime around exercise.
Here are the top 7 tips to get you started, but you can ask your healthcare team for advice specific to you. Number 1. Monitor your glucose levels before, during and after exercise to learn from your patterns. Remember, if finger pricking, wash your hands, as sweat on hands can affect the glucose reading. Number 2. Do not exercise if you have a glucose level above 14, with ketones above 0.6. Number 3. After you have finished exercise, monitor your glucose levels closely. Check your glucose to see if you need a snack. Slow-releasing carbohydrates may be helpful to prevent low glucose levels later on. Number 4. Having raised glucose levels during exercise can make you feel tired and make it difficult to perform to your full potential. Having more stable glucose levels during exercise will ensure you can perform to your best ability. Number 5. Keep your hypo treatment and meter at the location of the activity. For example, on a sports pitch or side of a swimming pool, rather than in a locker in the changing rooms. Number 6. Tell your friends and your coach that you have diabetes, or ask your diabetes team to give you information leaflets to share with them. Number 7. If your glucose level is less than 4, treat with fast-acting carbs. There are professional sports people who have diabetes. The important thing is to go out and be active. Celebrities living with type 1 diabetes. Henry Slade, a rugby player, said, "It's frustrating having diabetes, but it doesn't stop you doing anything." Johnny Laby, EastEnders actor and dancer, thinks, "Everyone with diabetes is in my eyes a bit of a legend." Jeremy Irvine, actor, said, "I've always had the opinion that everyone has something to deal with and there are worse things than having diabetes." Mary Mouser, Cobra Kai actor, explains, "If I could impact just one version of me who really needed to know that you can do absolutely anything and also be type 1 diabetic and that it can make you stronger. It adds grit and bravery and strength to all the things that you do in life. That would mean the world to me."
Session 11, Future Complications. One of the blood tests we did when you first came into hospital was something called HbA1c. We will check your HbA1c level every time you come into clinic. The glucose in your blood sticks to your red blood cells. HbA1c measures how much glucose has stuck to your red blood cells over the past 3 months. The more your glucose levels are within target, the lower your HbA1c will be. This is important because if you have high glucose levels for a long period of time, the high levels can cause serious problems with your health when you're older. These problems are called complications. Time in range is the amount of time you spend in your target glucose range. It's usually set between 4 to 7 millimoles per litre. Sometimes it's 4 to 10. Using time in range with HbA1c can be an effective way for your healthcare team to review your diabetes care to help you reduce any risk of long-term health problems. Aim for a timing range of 70% and above, as this means your diabetes is being well managed. When you're first diagnosed, your HbA1c is usually high and in the red zone. You'll have had high glucose levels for a while, but soon the levels will fall. You're aiming for your HbA1c to be below 50 millimoles per mole, or 6.5% by the time you've had diabetes for 3 months. We know that your risk of complications is directly linked to how long you've had diabetes and how high your HbA1c is. If you get really good control early on, it can help you reduce the chances of you having complications. A HbA1c of 6.5% or 48 millimoles per mole or lower is ideal to minimize the risk of complications. Eye damage. From the age of 12, you will have a special eye check known as retinal screening test every year to make sure that there aren't any changes in your eyes due to diabetes. If changes are picked up early, they can be treated. It's also recommended for everyone to have an eye examination with an optometrist every year.
Complications. Kidney damage. The most common reason for kidney failure in young adults is diabetes that hasn't been looked after. We start testing for kidney problems from 12 years of age. Once a year, we send a urine sample off to check that your kidneys are working properly. Nerve damage. If your nerves are damaged because of diabetes, you won't feel pain properly. If you can't feel pain, you may not be aware of a cut on your foot, and because you can't feel pain, it may become infected and cause problems. Heart attacks and strokes. Heart attacks and strokes are more common in people with diabetes, and this is why it is important that you don't smoke. Smoking makes you more likely to have a heart attack, and if you put smoking and diabetes together, then your chances of having one are greater. It is important that you keep your weight at a healthy level. We will also check your blood pressure once a year to make sure this is normal too. As explained previously, type 1 diabetes is an autoimmune condition where the body's immune system gets confused and attacks itself. If you have one autoimmune problem, then you have a slightly higher risk of having another autoimmune condition, such as a thyroid problem or celiac disease. This is why you will have a blood test once a year to check that these other parts of your body are working properly.
Session 12. Travel and Lifestyle. You will still be able to travel anywhere in the world, but good preparation will ensure you have an enjoyable time. We advise that you discuss your specific travel plans with the diabetes team well in advance. Everyone should follow these basic principles. Take a double supply of all insulin and equipment. Keep all insulin and equipment in your hand luggage and separate the items between different travellers. This way, you are not going to panic if any hand luggage gets lost or stolen, as you will have another set of supplies. Do not pack insulin in your suitcase if flying, as it will freeze in the hold of the aircraft and then you wouldn't be able to use it.
Here are all the items of equipment you will need to take with you when you travel. Insulin pen and your fast-acting insulin and long-acting insulin, needles and a small sharps bin, finger pricker and lancets, glucose meter and testing strips, ketones meter and ketone strips, batteries and charger and cables, glucose tablets and other hypo foods, plus glucagon or gluo, glucose gel for severe hypos, your carb ratios and correction plan written down in case your meter breaks, sick day rule information, identification to show you have diabetes, such as a wristband or necklace, a travel letter from the diabetes team, insurance details and travel company details, If you are on a pump or sensor, you will also need a spare pump plus spare pump reservoir, insulin and cannulas, your sensor and spare reader, also spare clip and belt.
Travelling. When travelling by plane, don't forget to ask your diabetes team for a travel letter, which will state your diagnosis of diabetes and the equipment which you will need to carry with you. Inform your travel insurer that you have type 1 diabetes and take your travel insurance details with you. Here are some tips. You should declare items you are carrying when you go through customs. Do not allow your glucose meter, CGM or pump to go through the X-ray machine, or check with the manufacturer if they are safe to do so. If you are travelling to a hot climate, keep your insulin in a cool place out of direct sunlight. You could use a cool bag or fridge, if available, to store your unused insulin, but make sure it does not freeze. Hot or cold weather can affect your diabetes, so keep monitoring your glucose levels regularly. Take a small sharps bin that can be sealed for the journey home. The diabetes team can help prepare a travel plan if you are travelling to a different time zone. Lifestyle. Activities. Diabetes won't stop you from doing all the things in life that you enjoy, as long as you manage it well. Your diabetes team will work with you to achieve this. There are lots of very successful and well-known people like Olympians and politicians who have type 1 diabetes. If they can do it, then so can you. As a teenager or young adult, some activities may need a little more planning than others, such as going to a party, a music festival, or going away with friends. Recreational drugs and substance misuse. As well as being illegal, drugs and other substances have a huge impact on diabetes and well-being. Your diabetes team will give advice should you need support. Alcohol. When you are old enough, you may want to drink alcohol. You will be able to, but you will need to take extra care because alcohol can affect your diabetes. One of the effects is an increased risk of hypoglycemia. Do not drink on an empty stomach. After drinking alcohol and before bed, have a slow carbohydrate snack without any rapid-acting insulin. It is important to get more information on drinking safely from the diabetes team. Smoking. Smoking is not recommended due to the effects it can have on your diabetes and long-term health. Anyone who has started smoking will be offered help to stop. Finally, don't forget to ask the diabetes team for a copy of the Stepping Up magazine.
Carrying identification. It is important to remember to wear some form of identification to show you have diabetes. For older children and young adults, a bystander may confuse your symptoms with the effects of alcohol or drugs, so wearing an ID wristband or necklace will help you get appropriate help and treatment. Your diabetes team can advise you where you can purchase these items. Many mobile phones have a medical alert section on the phone that paramedics know about and will easily identify a patient as having type 1 diabetes. Employment. As you get older, you will start to think about a job you would like to do or a career you would like to have. Whether it's being a zookeeper, a teacher, or a nurse, having diabetes won't stop you from doing what you want to do. However, there are a few exceptions to this, such as being in the armed forces. This is for safety reasons. Driving. You will be able to drive a car when you are old enough, providing you have good control of your diabetes and are hypo-aware. Don't drive if your glucose is under 5 mmol per liter. Remember 5 to drive. Ramadan and fasting. Children who have not entered puberty and people with diabetes are exempt from fasting during Ramadan. There is an increased risk of both hypo and hyperglycemia when fasting. If you need further information, please talk to the diabetes team. Dental health. Using sweets for hypo treatments such as jelly beans can cause tooth decay. Hypo treatments drunk through a straw, such as orange juice, are effective at treating your hypos and allow less sugar coming into contact with your teeth and potentially less tooth decay. Brushing your teeth twice a day and having regular checkups with your dentist is important. Remember to tell your dentist that you have diabetes.
On Facebook, search for the pages and groups for Deapp Education, the Insulin Gang, Beyond Type 1, T1 Access to Sports, Type 1 Teens, Type 1 Foundation, Type 1 Diabetes Support and Information, Parents of Teens Living with Type 1 Diabetes. On X, Deapp, the Diabetes Education App, JDRF UK, Diabetes Social Media Advocacy, Diabetes UK, diabetes.co.uk. On YouTube, search for Living with Type 1 Diabetes, A Day in the Life of Tom, and Professor Bumblebee's Guide to Type 1 Diabetes. Here are some useful links and websites. On any search engine, look for Deapp, spelled D-E-A-P-P, the Diabetes Education App by HealMed. Go to heal-med.co.uk. Diabetes UK have some great information on going back to school, bullying, going to university, top tips for teens, and some fun stuff. Also look at DigiBeat, the Disability Living Allowance, JDRF, and the NHS website.